We talked a few days ago about the definition of congenital disorders. Today, a few more definitions just so we get our wording straight. There are 5 main types of errors in development: malformations, disruptions, deformations, sequences, and syndromes. Malformations are intrinsically abnormal errors in development, meaning that they are present from the beginning and not related to some outer influence. They are usually the result of multiple genetic defects as opposed to a single gene defect. An example is anencephaly, absence of the brain. Disruptions are extrinsic disturbances in development, meaning they arise from some outside incident and are not inherited. An example of a disruption is amniotic rupture with subsequent development of amniotic bands. Deformations are also extrinsic abnormalities, but unlike disruptions, they are caused specifically by abnormal pressure on the fetus. An example of a deformation is club feet, caused by decreased amniotic fluid and less cushioning around the fetus. Sequences are cascades of abnormalities triggered by one initial malformation, disruption, or deformation that secondarily affects other organs. An example of a sequence is the oligohydramnios sequence, in which decreased amniotic fluid leads to not just club feet, as described above, but a flattened face, positional abnormalities of the hands and feet, and stunted growth of the lungs. Finally, syndromes are constellations of abnormalities that can't be explained by a single localized defect. Syndromes are often caused by viruses which affect several unrelated organs and tissues.